Good afternoon. Thank you all so much for joining us today. This is Christina Newport, and I am a program manager on the U.S. Medical Assistance team at AmeriCares. Uh, we are right at 12:30, so we are going to go ahead and get started. And during our time together today, I'll be sharing information with all of you about AmeriCares and how you can access free medications and supplies for your centers and the people that you serve through our U.S. Medical Assistance program. I'll also provide an overview of the new mental health initiative that we launched this month, targeting mental health and behavioral health providers. Toward the end of the presentation, I will also highlight one of our current community health center partners and show you how they utilize and benefit from our donation program. Joining me today is my colleague Lindsay O'Brien, manager of the U.S. Medical Assistance team, and Lindsay will be helping to facilitate the webinar and also the question and answer session. Just a few housekeeping items before we get started. On the left-hand side of your screen, you will see an area where you can submit questions throughout the presentation. Those questions will be sent directly to us, and we will try to address them either throughout the webinar or during the Q&A session. Because there's so many people joining us today, which we're completely thrilled about, everyone's lines have been muted for the duration of the webinar. So if you do have a question as we go through the slides, please chat them into us through the box as we go along. You'll also see on the right-hand side of your screen a web link section toward the bottom, and here you can navigate to the different websites we'll mention throughout the presentation. Before we get started, I would love to learn a little bit more about all of you. So if you haven't already, please take a moment to complete the poll that you see on the bottom left-hand side of the screen, just to let us know what type of behavioral health facility you're joining us from today. And I'll give you just a minute or two to complete that poll. Fantastic. So it looks like we have a variety of folks joining us from different types of organizations, mostly from community mental health centers. But we do have a couple of nonprofit government agencies, looks like some substance use and addiction treatment providers. So a good variety of folks joining us. So thank you for completing that poll. So I'd like to start by giving you an overview of AmeriCares. We are a global health and emergency response nonprofit organization, and our work centers around confronting crisis and creating change in underserved communities across the globe. Ours is truly a partnership model that focuses on building local capacity in the communities that we serve. AmeriCares was founded back in 1982, and we are headquartered in Stamford, Connecticut, though we do have field offices in India, Haiti, El Salvador, Liberia, Sierra Leone, the Philippines, and Japan, with a growing global presence. Though we've been in operation for more than 30 years, our work and our ongoing medical assistance here in the United States was launched in response to Hurricane Katrina in 2005. Since then, we have developed a vast partnership network of safety net facilities in all 50 states. AmeriCares partners with a variety of corporate donors who donate medications, medical supplies, and vaccines to our organization. We then make those donations available to our more than 3,500 partners around the world. And last year alone, we donated more than $525 million in aid worldwide, which is enough to fill 14 million prescriptions. 85 million of that aid was donated in the United States alone. So we essentially have three core programs or pillars of the work that we do at AmeriCares. And the first are emergency programs, which include emergency response, recovery, and preparedness. And this is where we work to expand and restore health services in times of natural and also man-made disasters. And we also prepare the local communities that we work with to address these types of events before they happen. We typically respond to more than 25 disasters each year. The second pillar of the work that we do are our global health programs, and this is under which our U.S. Medical Assistance Program is situated. And here we are working to increase access to healthcare through both the delivery of donated medical commodities and also targeted programmatic initiatives. Finally, we also provide direct primary care services to low-income patients through the 4 AmeriCares clinics we operate in Connecticut, our family health clinic in El Salvador, and 3 mobile medical vans in India. And we utilize these clinics as learning centers to better inform our programmatic work. So now I want to focus in on the work that we do domestically. So our U.S. Medical Assistance Program really works to expand access to care, to enhance the delivery of comprehensive treatment, and to improve health outcomes among the poor and underserved. We are the largest provider of donated medicines, vaccines, and supplies here in the U.S. The way that our program works is that we distribute a variety of donated medicine and products to safety net institutions across the U.S. by partnering with these organizations that serve the and underinsured. Our free product donations for clinics and health centers are shipped via FedEx to our partners at no cost. And we are licensed to ship and distribute pharmaceuticals in all 50 states. As I mentioned earlier, we have relationships with over 200 corporate or pharmaceutical donors. So these are pharmaceutical and medical supply companies that offer donations to AmeriCares. And they offer these products due to a variety of reasons. It could be excess inventory, medications coming off patent, through targeted Produce to Give initiatives, and also in response to specific requests. AmeriCares reviews the offers we receive from corporate donors and decides how much to accept based on expiration dates, the amount of product offered, the value of the product being offered, and probably most importantly, based on what our partners need. There are other elements of the work that we do that I also wanted to mention here. And the first is that we also offer a variety of capacity building programs for our safety net partners, which I will talk about a little later in the presentation. And we also facilitate emergency response efforts in times of emergency or disaster here in the United States. So if you're a partner of ours and something was to happen in your area, like an earthquake or tornado or floods, we would reach out to you and offer our support in those times of need. Our overarching U.S. program was established and is sustained with ongoing support and in partnership with the GE Foundation. But we did receive additional support and a financial contribution to expand our existing network and to develop a targeted initiative for community mental health centers and other nonprofit behavioral health providers. And this came from 2 individual families that are really committed to this work. And this has helped launch our new mental health initiative, which I'll talk about in just a minute. But first, I wanted to show you an illustration of what our partner network looks like. So we have 810 partners that together operate more than 2,100 delivery sites and serve more than 5 million patients. So we serve a pretty diverse network that enables us to reach into the full healthcare safety net. A large percentage of our partners are concentrated in the South and in the Midwest, as you can see by the numbers. So I thought it would be interesting to pause here to get a visual to see where everyone is joining us from today. So in a minute, you're going to see this map populate on your screen. And what you can do is take a minute to zoom in on the United States. Once you get there, you're going to see like a key in the upper left-hand corner with a purple pin. If you click and drag that pin over to your location on the map, it'll show me where everybody is calling in from today. And I'll give you all a minute to do this. Very good. So it looks like we've got a bunch of folks calling in from Iowa. We've got some folks from Florida, a good portion of folks from Florida. We've got somebody joining us from California, from Georgia, Virginia, So we've got folks from all over the board, which is fantastic. And it doesn't surprise me that there is a general concentration in some of the states that I mentioned here, because the majority of states that you see represented here today are states that we've targeted for our first year in our expansion into the mental health sector, which we'll talk about here in just a minute. So back to taking a look at our current partner network. In terms of the breakdown, based on the types of partners that make up our network, a little over half of our partners are coming from free and charitable clinics. We also work with a sizable number of community health centers, health departments, and social service agencies. As you can see through this slide, we only have a very small number of community mental health center partners. So this is not really a group that we've traditionally served under our US program. And this tells me that it means that there's much more we can be doing to engage mental and behavioral health providers at AmeriCares to provide access to the support and the resources that we offer. And this is what we aim to do under our new mental health initiative. So under the mental health initiative, we have received funding by two very generous families committed to enhancing resources in the mental health safety net sector to launch this new initiative under the umbrella of our US program. And what we're looking to do and what our goal is to expand and develop a new partner network of community mental health centers and other nonprofit behavioral health providers. So we'll be working to bring new partners on board from the behavioral health sector into our network to try to increase access to healthcare and needed medications for the low-income and underinsured people that you serve with mental illness or behavioral health disorders. Because this is a newer initiative, we are also working simultaneously to engage our existing pharmaceutical donors and also to reach out to potentially new donors to further develop and enhance our product line of targeted psychiatric medication to support this new group of partners we'll be bringing on board. So centers that come on board under this initiative will have access to our entire inventory of products, which includes both psychiatric and primary care medicines, medical supplies, and hygiene products, as we know that many centers are now providing some level of integrated primary care. So in this first year, as we launch this work, we decided to focus strategically on 10 states as a pilot demonstration. To allow us to grow sequentially, but also to learn from our partners as we develop this new network, with the goals of eventually expanding this work out nationally. And so the 10 states you see here on this slide were selected as our pilot demonstration states. But no need to worry, if you're calling in from a state that's not on this list, you will still be able to join this effort under this new initiative. So even though we have only a small number of community mental health center partners currently, what we know is that of those partners that we do have, we have provided more than $1.4 million in aid since 2013, and that these partners have benefited from the variety of donated products that we offer, from psychotropic medications to primary care medications. So we're really excited to launch this new initiative, which we kicked off this month to coincide with Mental Health Awareness Month, and to further serve as a resource to you and the people that you serve. So I know that I am speaking to an audience who is familiar with the problems faced by those who suffer from a mental illness or behavioral health condition, and especially for those who also lack health care coverage. The map that you see on this slide is an illustration from a report published by the American Mental Health Counselors Association that reported almost 3.5 million adults with serious mental illness and substance abuse disorder are being left out of coverage in non-expansion states. Though we know that healthcare reform has reduced the number of Americans who are uninsured, there are gaps that still remain, even in states that expanded their Medicaid program. We're seeing a growing number of people moving kind of into that underinsured bracket. So those who can't afford the cost of treatment due to out-of-pocket cost, high deductibles, and copays. and those that have difficulty accessing the benefits they do have under their new coverage. So all of this means, as you know, that there are still barriers to access and treatment that we're seeing. And one of those is the ability to pay for prescription medications. We know that 21% of the uninsured and 14% of insured adults cannot afford or forego their needed prescription medications due to cost alone. So the Mental Health Initiative really aims to help address this by not only reducing out-of-pocket costs for clients that could potentially benefit from our donations, but also by expanding treatment options available to those who are served by your centers. So in late 2013, we conducted an external evaluation of our program to get feedback from our partners on how we were doing, but also to gauge their needs in anticipation of health reform. And based on the feedback from the 203 partners that completed that survey, we learned that our product donations have a significant impact on our partners and the patients that they serve. As you can see here, 90% of partners noted that our product donations provide budget relief, improve care, reduce costs for patients, and also improve staff effectiveness. We also know that by giving the patient the opportunity to leave their visit with the medicine in hand helps to increase adherence to medication therapy. So you might be wondering, out of the $85 million in aid that we donated last year in the US, what types of products are we talking about? So the top categories that we donated by value were cardiovascular meds, anti-diabetic medications, and also respiratory meds. But there were other significant categories, which includes psychotherapeutics. So the two largest psychotropic medications that we have received donations of in the past are Seroquel and Cymbalta. We've also received donations of citalopram, norepinephrine, haloperidol, olanzapine, Invega. So we've gotten a number of other types of psychotherapeutics donated to our organization that we have made available to our partners. As I mentioned earlier, since we're launching this mental health initiative this month and gearing up, to really do more outreach in some of those states we have identified, moving forward, we are targeting an increase in donations of psychotherapeutics for the behavioral health providers we bring on board. So we're really working to continue to build our inventory for this initiative and hope to see growth in this area in the coming months. In terms of the supplies that we've shipped out, the top categories in value were syringes and pen needles, followed by sunscreen, chapstick, and shaving cream. But I wanted to note here that the products that we have change on a regular basis and are also available on a first come, first served basis. So we receive donations on a pretty regular basis, and we update our inventory accordingly once those donations have been accepted by AmeriCares. So I thought it was important to highlight the ways in which we complement other pharmaceutical access programs, but also the key ways in which we're different. So unlike discount programs and procurement, all of the AmeriCares products are entirely free. There are no membership or hidden fees for any of the products that we offer. We are different from patient assistance programs in that AmeriCares products are shipped by the case to your health center, and you choose how to distribute donations as long as they're distributed to patients that meet our eligibility criteria, which we'll review in just a minute. Donated medicine can also serve to fill the gap that can sometimes occur during the period of time when patients are waiting for patient assistance programs. Products are not sent to individual patients too, and there's only one application for our program. So you're not asked to submit an application for each patient or for each product. Also, AmeriCares donations are not samples and they are never compromised. We carefully vet every offer from donors that we receive, and we only accept those that are high quality products, but also that we know will be useful to our partner network. Finally, our partners choose what they wish to order, so no products are ever shipped to partners unless they're specifically ordered from our website. So let's talk about the eligibility criteria and what centers will need to have in order to become a partner. First, you have to be a nonprofit mental health or behavioral health facility, and you must also serve patients who are either uninsured or underinsured and whose income is below 300% of the federal poverty level. We also require that our partners have an inventory management process or procedures to track the distribution and usage of Americare's donated products at the patient level. So you must have a way to track what patients receive the medications that have been donated by Americares. Although we require you to have a process in place, we don't ask our partners to provide us with any patient level data or to report specifically on patient health information, protected patient health information. In terms of the patient eligibility criteria, oops, here we go. And those who can receive donations from Americares, patients, again, must have an income below 300% of the federal poverty level, and they must be either uninsured or underinsured, which means that patients who have coverage under Medicaid or Medicare or even that have other health coverage, but if they're unable to afford their prescription copay or if they don't have prescription drug coverage, they would be eligible to receive Americare's donated product. So I wanted to touch now on the logistics of becoming a partner. First, we have a website, usaccess.americares.org, as you can see here on this slide. And you can actually navigate to this website by clicking the link on the slide, or also on the bottom right-hand side of the screen under the web links section, there's a little area that you can click on where it says apply to become a partner. When you get to this site, there is a red button that you'll see on the right-hand side of the screen that says click here to create an account. And this will bring you directly into the application. Once your application is complete and submitted, you will complete a 15 to 20 minute introductory phone call with an Americare staff member. And that's just really to review all of the elements of the application, to answer any questions you might have, and then you go through the approval process. Once you become a partner, you will have access to our product inventory through this same exact website. You will be required to maintain up-to-date licenses in your account. We will also ask partners to confirm receipt of all shipments. So when you do place an order for product to your health center, once you receive that shipment, we just ask that you confirm you've received it as you place the order. And also that you have the ability to track where your dispensed medications go to. I think I might be having some audio difficulties. I don't know, can you all hear me? And if you can, maybe you can chat into the question box so I can see whether or not I am still connected. Okay, so it sounds like some folks are having difficulty hearing me and others can still hear me pretty well. So I tried to fix a setting in the system, so hopefully everybody can hear me now. And I'm just going to keep moving forward. Okay, we should be back up and running. Okay, so where was I? So I think I was just wrapping up this slide on becoming an Americares partner. So again, creating an account on US Access, completing the introductory phone call with our staff member, and then these are the required elements once you are approved as a partner that we ask you to complete. So once you become a partner of our program, you will receive a username and password for our US Access website, and it's the same link that you use to complete your application. This is where you can view our available inventory in real time and place orders for the products that you want in the quantities that you need. We will also send a weekly email to notify partners of the new inventory we receive, and that email goes out every Sunday. Once you place an order, it comes to our team at AmeriCares. We process it internally and we pass it on to our warehouse, who ships all of the products to you. And again, this is done at no charge to your center. As I mentioned earlier, we only have a small number of community mental health center partners that are part of our partner network now, but we're already starting to see a growth in this numbers, and we approved and brought on 3 new partners just last week. But I wanted to highlight one of our current partners from Georgia, Unison Behavioral Health. They are a community mental health center, and they provide a variety of services, including substance use treatment. They also have a residential treatment facility. They have been a partner of ours since 2013, and they see more than 6,000 unique patients a year and over 93,000 annual patient visits a year. And their budget is just over $12 million annually. Unison is one of the largest partners that we have as measured by the value of product that they've received from us, having received over $300,000 in donated product for use at their location. Some of the examples of the products they receive from us are haloperidol, Seroquel, olanzapine. They've also received insulin syringes, multivitamins, shaving gels, and other hygiene products and supplies. So as you can see, they've received a variety of products from us since becoming a partner. And I spoke with Norma, who's their pharmacy manager, yesterday, where she offered this little tidbit in terms of how the donations from AmeriCares has impacted the work that they do. And she said, the donations and products we receive from AmeriCares enables us to provide more services and support to the people we serve. We're able to give our patients more and help in other areas of their lives, as well as increase access to the needed medications and treatment. So this just gives you a sense of how becoming a partner of our work and benefiting from our resources has impacted their center. So before we kind of wrap up and open this up for the questions and answers, I also wanted to mention another piece that we really believe sets AmeriCares apart. And these are the programs that we've developed and implemented to try to build capacity in the safety net. So the programs that we've launched and are working on in 2014 and now moving forward include first a Produce to Give initiative that we've partnered with a major pharmaceutical company that provides a 1-year supply of medications for 3,000 patients, and it includes reporting on patient health outcomes for the participating clinics. We've also implemented sophisticated programs that involve training-free clinics on evidence-based interventions related to prediabetes and resistant hypertension. We're now in the process, too, of developing a customized inventory management system with the healthcare IT organization that will be rolled out through a cohort of free and charitable clinics that don't currently have an inventory management system or software. And I just wanted to mention these now to give you a sense of the types of programs that we offer. And our vision is that once we develop a network of community mental health centers and other nonprofit behavioral health providers, that we will have the potential to offer capacity building programs like these and others to further support the work that we do with this group. We also have an online resource library for SafetyNet facilities, and that's safetynetcenter.org, where we have additional information and resources that we've developed specifically for the SafetyNet. So before I open it up for questions and answers, and I'm hoping everybody's still connected and everybody can hear me well, we just wanted to show this slide. We love to show this during presentations that we make because it illustrates the reach of the U.S. Medical Assistance Team. So this is the Iliac Family Health Center, which is one of our partners. They're located probably as almost as far away as you can get on the Aleutian Islands in Southwest Alaska and say that they are recipients of our donated products. And I'm not exactly sure how we get the products there, but we certainly do. So we just love to show this slide to kind of demonstrate the reach of our program. So I realized we have plenty of time left, and I'm glad that we do because I wanted to open up the line for any questions you might have or comments about this work. And so please feel free to chat your questions into the question box that you see on the upper left-hand side of the screen. As you think about your questions and as you do that, I'm also going to be pulling up a new poll. You should see it appear in the bottom left-hand corner. So this is just to get a sense from you all about your next steps and plans with regard to partnering with AmeriCares. So if you can complete that poll while you think about whatever questions you might have for us, that would be great. You can also see here on this slide my contact information. So if you have any questions for me that we aren't able to get to during the Q&A session, please feel free to contact me after the webinar today, and I'm happy to answer whatever questions you might have. So with that, Lindsay, I am going to turn it over to you. I know you've been monitoring the questions we've been getting throughout the presentation. So please, feel free to shoot if there are some questions that we can help to address. And Lindsay, I think in order to connect the audio, you may have to push #6
Christina,
to unmute your line.
Christina, can you hear me now? Can you hear me? Christina?
Oh, it sounds like we may be having some trouble connecting Lindsay's audio. So I'm going to see if I can scroll through the questions we've received and try to answer them as we go. So from Dee Dee Chance, the question that you have is, what is your capacity for the number of partners you will accept? And we're fortunate at this time that we are able to take on as many new partners as we can. And so we're not placing limitations on the number of partners we'll accept under this initiative. So, we'd encourage all of you, if you are interested, to move forward and submit an application. So it looks like the next question we have is from Lori, and she said, since you mentioned these are not samples, are agencies required to get a dispensing license? So what we do require in terms of your ability to distribute medication is that, oh wait, it looks like, sorry, just a little bit of technical difficulty here. But we do ask that the center or facility either operate a pharmacy or have a dispensary or have a medical professional that is licensed to distribute or dispense medications at your center. So that's part of the application, and a question that we ask when you're completing your application is how you will provide information about your center's ability to distribute and dispense medication. Okay. There's a question coming in from Hillcrest, so I just wanted to address this question now since others might have this question. And she said, from Hillcrest, we have several CMHCs under the same 501c3. Would we complete a single application or multiple applications? And so the answer is you would submit one application for your center. Okay. From Mary, there's a question about whether or not agencies need to maintain records of proof of income per patient. And so this is something that we ask again as part of the application process. We will ask a question on the application to get at how you determine the patient eligibility to receive our donated product. But we don't ask you necessarily to provide that proof of income per patient back to us. We just need to know that you are able to determine their eligibility criteria and that you have a process in place in order to do so. But again, we don't ask you to report that information to us. Brenda Mathias asked, would we need to keep a separate inventory? So one of the requirements that we have is that the donations that you receive from AmeriCares must be segregated from other products. So one of the things that we provide are AmeriCares stickers that you can adhere to the boxes of medications you receive from us. So, as long as there's a way to keep the products you receive from AmeriCares segregated from the other products you receive, then the answer is yes, you do have to keep them separate. So Kelly asks, how long from the date that we go to the website to register can we expect to hear back if we're accepted as a partner? And so the answer to that is, I think that the time will vary a little bit, just depending on, the information you submit on your application. But you can expect to hear back from our staff, within a week or so of submitting your application to schedule an onboarding phone call. So once you submit your application, we will schedule a brief 15 to 20-minute phone call with your site to go over that application and then any other information we may need from you to be submitted as part of the process. And then as soon as we have all of that information compiled, your center will be approved as long as we have all the information we need. So it could be a few weeks, just depending on that give and take and back and forth. Okay, I'm trying to slug through these questions here. So we have a question from Elaine that asks, are community health agencies required to charge any type of filling fee for prescriptions, or is this allowed? So the AmeriCares donations that you receive cannot be charged. So patients can't be charged for their medications that you receive from AmeriCares. However, if you do have a dispensing fee for administrative or service fees related to your clinic operations, those are permissible. However, one of the things that we require is that the medications are not withheld from patients if they're not able to pay that dispensing fee. So I hope that answers your question, Elaine. Okay. So Stephanie asks if there's a formulary available online that provides information about the psychiatric meds that we have available, or if you have to apply first before seeing the formulary. So all of the inventory and products that we have are maintained in a list in US Access, and so you do have to be approved as a partner before seeing the products that we have available in our inventory. What we can do, and one of the things that we've provided in the past, are a list of donated products that we've received last year, just so you can get a sense of the types of products that we've had available in our inventory before. But otherwise, in order to see our real-time inventory, you would have to be an approved partner to be able to log in. And Lindsay's providing a clarification. Oh, I think I answered that. So yeah, we can provide the medications that we've received in the past. So again, you can get a sense of what we've received. As I'm going through to some of the questions that we've received, I wanted to pull up on our final slide a link to a survey. And so as I mentioned before, one of the things that we really try to do is to match our partner needs with our requests for donations from our pharmaceutical donors. And so this survey asks questions to help us get at, what your top needs might be. And we're just trying to learn as much as we can from potential partners in this space. So if you can take a few minutes, you can actually navigate directly to the survey by clicking the link on the slide. And we would really appreciate your input and your feedback as we launch this new mental health initiative. So Sharon had asked if we can provide a copy of the presentation, and we certainly can. We are recording this webinar today, and following the webinar, we will be sending out an email with a link to our website where you'll be able to access not only the slides, but the recorded version of the presentation. Okay. Pardon me while I scroll through some more questions here. Lisa asks, what are your recommendations for inventory management, Excel or other software? So there are some web-based software programs for inventory management, but if that's not something that your center has, Excel would be acceptable as long, again, as you have a way to track where the donations go to the patient level. So, whatever process you put in place for that, I think would be sufficient as long as you have the ability to do so. And we do have several partners who utilize Excel to allow them to do so. So Michelle asks, can you revisit the license requirements? We have a medical director who is an MD. Will his license allow us to participate? And the answer is yes, as long as that person has license to dispense or distribute pharmaceuticals, medications, then that would allow you to participate and make you eligible in the to become a partner. Okay. So it looks like I have gotten to most of the questions we have received. I want to make sure to be able to answer any other questions you might have. So if I haven't gotten to your question, please feel free to either re-chat it through the box or ask your question now. We still have a few minutes left for the webinar, so feel free to chat your questions in. Oh, we have a question from Mary that I wanted to address here. It looks like Lindsay had answered it, but I want to make sure everybody has the ability. So Mary asked, are the medications available as stock or bulk, or can unit dose be accessed for some? And so all the medications are in bulk and are sent by the case. Hillcrest brings up a great question, and this hadn't come up in the presentation, but I'm glad you addressed this. So her question is, will we follow our own product destruction procedures for expired or damaged meds? And the answer is yes. So expired products that you receive from AmeriCares cannot be distributed or dispensed and must be destroyed in accordance with your local regulations, laws, and manufacturer guidelines. And so one of the things that we ask as part of the application is what is your destruction procedure? And making sure that you have a protocol in place for destruction for expired or damaged meds. And so that is part of the application process and something we'll review in detail with you during your onboarding phone call. Okay. So it looks like we have gotten to most of the questions we've received. If there are any other questions, feel free to chat them in now. But if we didn't get to anything that you wanted to ask, or if you have further questions for us, don't hesitate to contact us. You can use the information you see here on this slide. You can contact me through email or even by phone, and we would be happy to talk with you a little bit further and answer any other questions you might have. Again, we want to thank you all for joining us this afternoon and spending this hour with us to learn a little bit more about AmeriCares, our mental health initiative, and where we hope to go with this work. And encourage you all to think about applying to become a partner, because we'd love to work with you. And let us know again if you have any other questions. So thanks so much, everybody. I will leave this portion of the webinar up. So if you do have any other questions, we can chat our answers into you. But with that, we will conclude the presentation. Thanks again, and hopefully we'll be hearing from you soon.